Hello, I'm Allison Golnik, and I am a pediatrician at the university here, and today I'm going to share with you a few studies that we've done recently at the university. It's my honor to follow Larry here, who does such a nice job defining things and really naming issues and addressing them head on, so a lot of my work is done for me, and I appreciate that. Let's see. I'd like you to imagine this scenario with me. This family is visiting their pediatrician, and the parent might be thinking, "It's so good to see Dr. Smith again. She's always so nice. But I'm not sure if I'm going to tell her all the treatments we are using for Patrick. I'm not sure if she'll even know about them, and I think she might judge me. We know that the treatments help Patrick, but I don't know if she'll believe me about this. I bought a multivitamin specifically for children with autism on the internet. I know it's good for Patrick, but it would be helpful to know if there are any potential side effects and what we should be looking for. Sometimes we feel like we've run out of options. What does modern medicine have to offer for our child anyways? I just want the best for Patrick." And the physician could be thinking, "Oh, here's Patrick and his lovely family again. He's making such great progress. They have so many interesting ideas, and they are using so many treatments. I have not even heard about some of them. I wonder about whether any of them could be dangerous for Patrick. I really want to be supportive of them, but I really don't know that much about what they're doing. The big challenge for me is that they want answers, and I don't know if I have that many." So, these experiences are not unusual for physicians and parents, and might even be not that unusual for a lot of you out here that are other kinds of healthcare professionals. The key research question today that I'm going to be describing to you is, what are the attitudes and practices of physicians regarding complementary alternative medicine for children with autism? And the overarching goal of this research is really to bridge a gap that I've described here to you between parents of children with autism using CAM and physicians. So, let me start with here and give you some definitions of what I'm talking about today. I'm going to be talking about primary care. So, when I say primary care, I mean a physician and the medical team that really drives the child's care. Primary care is where a family first brings their concerns. They might even be the first concerns about autism, might be some concerns about sleep, but they first usually come to this person. And the primary care medical team provides long-term care so that they consistently come back to these people. This group may send them out and refer them out, but then they will come back to their primary care home. And also, the medical team is responsible for coordinating the majority of care. So this could be all sorts of different examples. Maybe a family practice doctor with a child who has asthma, or maybe even an oncologist with a child who has a cancer. And today when I say medical home, Larry touched on this, I mean primary medical care that is comprehensive, so it involves outside resources, and the physician and the team know about outside resources like social workers or appropriate therapists. The care is coordinated, so like I said, when the primary care home sends them out to see the neurologist, they come back and look at the recommendations together. And it's also family-centered, and that means that the physician and the team listens to the family and also clearly explains things, but even more, it really means that the family is involved in improving the care so that somehow the primary care team actively solicits inputs from the family and says, "How do you think the care is going, and what do you think we should do to improve it?" and then uses that input. And today when I say CAM, or complementary alternative medicine, I mean a group of diverse medical and healthcare systems, practices, and products that are not generally considered part of conventional medicine, but may be part of an integrative approach, as Larry's described for us. And when I say modality or CAM modality, that just means a method of treatment or therapy. So first I'm going to show you a study that we did here at the university. It was a national survey of parents. So we looked at parents nationally. And in the light blue represents the parents who reported that their child's primary care did not meet the goals that the medical home has set for them. And children with autism are on the left here. So you can see that children with autism are half as likely as children with other special health care needs, that's the acronym on the right there, to have medical homes. So what that really shows is that 3 out of 4 parents of children with autism reported that, no, my child does not have, and it was specifically comprehensive care, coordinated care, or family-centered care. So that's a lot of room for improvement for us. And we analyzed these differences. They remained despite adjusting for things like severity of the child's condition and insurance status. As far as background studies around CAM and autism, Larry's touched on quite a few. We know that from parent surveys, at least over half and maybe as high as 92% of families with children with autism, their children are being treated with these kinds of therapies. Larry also mentioned the survey that Greg Liptak did in 2006, which looked at families where families of children with autism were more likely than parents of children with other kinds of special health care needs to rate their physician's CAM knowledge as poor, and they wanted more information about this from their physicians. Susan Levy and Susan Hyman did a review in 2008 looking at the reasons for why families of children with autism used complementary alternative medicine. And they found that it really was not necessarily that they were dissatisfied with their conventional medicine, but more so that they desired multiple approaches or may have had concerns about side effects of traditional medicines, or maybe because of their personal health beliefs. So as far as physicians here on the right, we know from a lot of studies that physicians are interested in complementary alternative medicine, and they would like to get more education around this. What we don't know is we did not have any previous research on physicians asking them specifically about complementary alternative medicine for autism. So now I'm going to present to you a more recent survey that we did at the University of Minnesota. And this study asked physicians about their attitudes and practices around complementary alternative medicine. So we conducted a national physician survey, and the physicians were primary care providers, so we included family practice physicians and pediatricians. And we asked them about their attitudes and practices for children with Autism Spectrum Disorders, and from here on, I'm going to say autism. And these were individuals from birth to 18, but I'm going to say children as well. And we asked them to compare their attitudes and practices for children with autism compared to these other groups, so children with other neurodevelopmental conditions. This might be things like cerebral palsy or mental retardation, and also to compare them to children with other kinds of chronic and complex issues, which might be like cystic fibrosis or diabetes. And these kind of comparison groups can give at least somewhat of a frame of reference for a survey-type research like this. So we first asked the pediatricians and the family practice doctors, when a patient comes into your office, do you ask them about complementary alternative medicine? And the physician responses were on a 1 to 7 scale to rate how often they ask their patients about this. The light blue bar here on the left demonstrates the responses regarding autism. So you can see here that physicians who responded said that when a patient with autism walks through my door, if they have autism, I am much more likely to ask them about whether they use complementary alternative medicine compared to a patient who walks through with cystic fibrosis. I also gave physicians a list of potential barriers to care, and this included multiple things. Things like reimbursement is challenging for me, or I do not have enough time to care for this patient. But physicians reported that frequent use of CAM was a greater barrier for them when they saw children with autism. This study did not go into the reasons why they would say that this was a barrier or a challenge to their care. I also asked physicians, are you interested in more complementary alternative medicine education? And again, they said, yes, we are. And in particular, we're specifically interested in learning about this for children with autism compared to these comparison groups. Next, I gave a list of recommendations of CAM modalities. So this list is fluid, as Larry showed, and this list was also dreamed up a few years ago, so it changes so quickly. I am going to now present to you, let's see, I asked physicians whether they encouraged the modality or whether they would accept it if a family was already using it. whether they would discourage it, or whether they were not knowledgeable enough to give a recommendation. So now I'm going to give you kind of the top view in each category here. So physicians most frequently reported encouraging multivitamins, and this study did not differentiate the dose of these, essential fatty acids, melatonin, and the study did not ask whether or not that was for sleep use, and probiotics, and again, the study did not differentiate whether that was for GI symptoms. So from these recommendations, we might say that physicians who responded to this survey are integrating some CAM modalities that may be supported by emerging evidence but need further research. Next, as far as what physicians were most likely to say that they would accept if a family is already using, were the gluten-free, casein-free diet, elimination of sugar, preservatives, and additives, or probiotics and essential fatty acids. Physicians were most likely to report that they would discourage delaying and not completing immunizations, chelation, anti-infectives, which is a really broad category, could include something like an antifungal or minocycline, delaying but completing immunizations, or secretin, which is a gastrointestinal medicine that was used in years past and extensively studied. So from this list, we could say, potentially, that physicians in this survey reported actively discouraging some forms of CAM that have been refuted by evidence or carry significant potential risks. And as far as physicians saying, I don't have enough knowledge around this to give a recommendation, these were secretin, B12, chelation, and melatonin. So next, we conducted logistic regression to explore the associations between physician characteristics and encouraging at least one of these forms of complementary alternative medicine that were on our list. So nearly 60% of the physicians who responded to this survey encouraged at least one of the forms of complementary alternative medicine on this list. So the light blue on the left bars represents those who encouraged at least one form of CAM modality from the list here. So you can see that physicians who desired more complementary alternative medicine training and said, I want to learn more, or I often ask my patients about CAM use, or I feel that I have better on this scale CAM knowledge, were also more likely to be the ones that would encourage complementary alternative medicine. This slide is about education, and the left column of pies here are physicians who reported that I have previous autism training. I have gained this in medical school residency and continuing medical education. And you can see that on the left here, the physicians who reported that they had autism education were also more likely to encourage at least one form of CAM. Now, this study didn't look at what was the content of this education, and it was self-reported, and we're not able to tell what the quality was of the education either. And on this slide, you can see that females on the left were more likely to encourage at least one form from our list. And on the right here, younger physicians were more likely. And in the middle here, physicians who reported they had a greater number of patient visits of children with autism over the past year were also more likely to encourage at least one form. We also asked physicians their recommendation around applied behavioral analysis. And the physicians who reported that they would encourage applied behavioral analysis were also associated with those that were more likely to encourage at least one form of CAM from the list that we gave them. So there are limitations to this preliminary descriptive study. The response rate was lower than desired, but I still think it's hard to get physicians or anyone to answer surveys in this day and age. Responder bias is always a potential in surveys, and it's important to think about this. One thought that comes to mind, I think, right away is it's plausible that people who are really interested in complementary alternative medicine got this in the mail and opened it up and were excited to put it back in the envelope and send it back. I did ask people to rate their CAM knowledge on a scale from 1 to 7, and the average score of respondents was 3.5, so right in the middle. But of course, I don't have anything to compare that to. And despite the fact that the sample size was actually 500, it still did not allow us to analyze the CAM modalities individually in groups, so it would have been nice to be able to break these into groups, something like those that have some evidence and those that have no evidence. But we were not able to do that with the power that we had. We even tried to do that. So a conclusion from this study here is that physicians desire CAM training specifically for children with autism. And they often inquire about CAM when they see a child with autism, at least compared to our comparison groups. They view CAM as a challenge for practice, and specific CAM modality recommendations varied, and physicians who encourage at least one form of CAM from our list also reported greater, we could say maybe autism experience and the number of visits that they had and reporting education, and they also reported greater CAM interest in that they always asked their patients about it or were more interested in learning about it or reported greater previous CAM knowledge. The following are thoughts on translating this research to practice. So physicians should ensure that patients are using effective therapies, which is likely to include a combination of intense behavioral treatment and school supports and social skills and communication supports. And it's also important for the physicians to ask all patients who come through their door about CAM use, in particular children with autism because of the high prevalence of use. Physicians should use a framework to evaluate CAM therapies that their patients are using for safety and efficacy. And this is really a reason why events like today are so important for us all to come together and talk about these and start working on getting a frame to evaluate these things in. And we can work together to improve models of care. When we make improvements in healthcare infrastructure overall, then those changes can really spread to all providers. And examples of this might be reimbursement. They might be also providing providers tools for families to help them choose target behaviors and measure them over time. And models should really involve families in quality improvement, so really actively solicit feedback from families to then incorporate into the care models that we have. And I believe families should really lead this effort. Families can help to make medical care practical and more effective for them in their homes. And families know their children the best. So, thank you.